everyone, my name is Miranda Brown and today I'm going to be teaching you guys about female infertility. Whenever you're out in public, look around. There's a lot of women out there and a lot of them could be battling infertility issues and you would never know. What is infertility? Infertility is when someone has the inability to get pregnant after trying for 1 year. That's 1 year of unprotected sex. Infertility is also considered when a woman is able to get pregnant but not stay pregnant, so they unfortunately are going through a lot of miscarriages. 6.1 million American women suffer from infertility. That's 10% of American women in their childbearing years. And out of that 10%, 25% of them have more than one cause for their infertility. Ovulation problems are probably the biggest cause of infertility. And in order to know this, you have to know what ovulation is. It's when your ovary releases an egg and it travels through the fallopian tube where it will meet the sperm to create a fetus, hopefully. The number one cause of ovarian problems is going to be polycystic ovarian syndrome, and 1 in 10 women suffer from this. It has really bad symptoms such as painful periods, acne, obesity, unwanted hair growth, and really uncomfortable areas such as your mustache. Another important cause of ovulation problems is going to be the primary ovarian insufficiency, which is also known as early menopause. And this is when you're in your prime childbearing years and your ovaries are not working the way they need to. Blocked fallopian tubes are also really important reasons for infertility. So a blocked fallopian tube is going to prevent the egg from meeting the sperm and progressing to where it needs to go to get to the uterus. Now this is going to be traced back to pelvic inflammatory disease and endometriosis. Endometriosis is when the uterine lining you have, the stuff that makes up that lining is not only growing inside your uterus but also outside. So when it sheds on the inside, it causes a period, but when it sheds on the outside, it causes this blockage to form. Uterine conditions are really important for fertility. Now, fertility can be linked directly to your uterus, and you can have these things called uterine fibroids in your uterus that can cause abnormalities, making it really hard to conceive and maintain a pregnancy. Diagnosing the problem. Now, what you can do, the easiest, most painless, and the most cost-effective would be ovulation tracking. You can download multiple apps on any smartphone, tablet, Android, anything, and you can track these, and it's really important because you only ovulate for 12 to 24 hours a cycle. And that's a very small time frame to make everything go right to cause, pregnancy. And so it's really important and really easy to track your ovulation. You can get ovulation test strips from Amazon, Walmart. They're pretty accessible. Now you can also discuss with your doctor if you're not ovulating about surgeries, hormone testing, and ovarian reserve testing. Treatments. There are multiple different treatments. Unfortunately, they are a little bit on the pricey side. Now this can vary from medications for fertility drugs. You can do surgery, which would remove those endometrial blockages and the fibroids that we talked about earlier. And then there's also artificial insemination. It takes his best swimmers, your best eggs, puts them together, and puts them in there to hopefully cause a pregnancy in the most simplified way possible. Explanation possible. And then there's also in vitro fertilization. Reducing your risk factors are really important because it's a simple step you can take before trying to conceive to hopefully prevent infertility from happening, hopefully. Now, a lot of these reducing risk factors are just stuff you can do day to day, such as maintaining an exercise routine, a healthy diet, a healthy lifestyle. You want to try and skip out on a few drinks. A little bit of excessive drinking is pretty bad for your hormones. You can also try and manage your stress because they'll throw your hormones out of whack as well if you're stressed out. And then what's really important is you want to protect yourself from STDs because a lot of STDs lead to infertility if untreated for long periods of time. And a lot of the STDs that cause infertility don't have symptoms at first. It takes a while for them to show up. I hope you guys all were able to get something from this speech, and I really hope you guys are able to start digging into infertility a little bit more and learning about it. There's only so much I can say between 4 and 7 minutes. I've had to cut a lot out already. Well, all right, I hope you guys enjoyed everything. Bye.